Yes, we're ready.
Okay.
Taping now.
Okay, so when you start your assessment, what's the first thing you need to do? Okay, you guys do this in skills, right? You practice it all the time, right? So go ahead, introduce yourself.
I'm Tom Byrne.
Okay. And then what are you going to do?
Ask for her name and her armband.
Yeah, and look at her pretend armband. You're not going to have real armband, so just look. And it's just part of practice because they want you to make sure that you do it automatically next semester when you go to clinicals. All right, so then we get to general survey. Anywhere on the exam where it says you're just going to observe or look at something, don't worry about, now I'm observing for this or that. You don't have to tell us anything. We have questions we'll ask you, but you don't feel like you need to talk all the time when you're going through it. If you're looking at the patient at all, I assume that you are observing her. Okay, so you automatically should get points for that. Same for observe level of consciousness. But oriented times 4, you need to ask questions about. So what questions would you ask?
You know what day is.
Okay, so date.
Time.
Well, date and time kind of go together.
Line.
Nope. Help them out.
Place.
Place.
Name.
Name, person. Person, place, time. And then the fourth one is like another significant person or general knowledge type question, like who is the first president of the United States? Or
could you ask like a family member if you know the
Yes.
if you know the answer?
If you know the answer, then yes. What is your husband's name? What is your daughter's name? Something like that. Okay. Don't ask. Sorry. Don't ask a question like, who was the last nurse that was just in here? This is a tricky question. Nobody's going to get that one right. Observe the speech. There's another one of those observe ones, right?
You would do that.
If you are the partner, please be kind to the person who's checking you off and answer the questions appropriately. Don't just nod your head, okay, so that we can evaluate your speech. Head and face. No consistency, distribution, color of hair. Well, color of hair you're just going to be looking at. But consistency, how do you think?
It's like, she has like bald patches.
Yeah, touch your head. Put your fingers on it. There you go. So as long as you touch their hair and their head, I will give you points for that. Because the rest of it's just observation. Observe facial symmetry, features, and expression. Just by what you're looking right now is not sufficient for getting 2 points, right? If you want 2 points, how are you going to do symmetry, features, and expression?
Jaw, make sure.
Okay, you want her to do something. What do you want her to do?
Smile.
Frown.
Yeah, you can.
And that leads you right into the next question. So if you're doing one, you're getting points for the next if you do all these. Smile, frown, show teeth, blow out cheeks, raise eyebrows, tightly close eyes. Do you have to do all of those? No. Do you have to do more than 2? Probably, yeah, to get all the points. Yeah. Minimum. So, Miss Coleman, so if I do 3 of them, am I going to get 2 points? I don't know. Yeah, probably. But do at least 3. Do them all if you can remember them. Test sensations of forehead, cheek, and chin. Granular 5. How are you going to do that?
Cotton.
Water.
Water. Splash water in her face. What happens?
Wait, no.
And now what kind of instructions are you going to give her?
She can tell me when she can feel it.
Yeah?
Close
Okay,
your
but you want to
eyes.
have her do something what?
Close her eyes.
Okay, close your eyes.
Tell me when you can feel it.
Okay. Now the problem with this is granular 5, you're going to have nerves on the right side, you're going to have nerves on the left side. Okay? This is your trigeminal nerve. Got 3 routes, or 3 routes to the nerve. One here, and one here. One here, one here, and one here. It's like a broken something, right? So where are you going to want to touch her?
So you'll touch her.
On the side. Very good. So what I would do, my recommendation, and you all see this video. Say, just tell me when I'm touching you. You don't even have to say where or touch it or anything. Just say now. A little delay between one of them, so it's not like a pattern. But yeah, you want to get all 6 of them. Okay? All right. Oh, or my eyes. What's UM?
When they can move it up, down,
What's UM stand for?
Movement.
Or muscles. Yeah, very good. Granular's 3, 4, and 6. And so go ahead and go through it. Do the test. And don't move your head. Just move your eyes. Good. And that's a decent speed too. Don't go so fast that they're like, having a hard time doing it. Make sure you go up and down, side to side, and then do the 4 corners. Okay? Inspect external eyes, lids, lashes, for the most part, sclera, iris. You can get just by looking. Conjunctiva, what do you want to do? Yeah. The only thing you want to do for this observation, make sure you get all 2 points, is pull down on the lower lid. So you're looking at the conjunctiva underneath. Okay, PERLA. What does PERLA stand for?
Pupils equal.
With accommodation. Very good. So how are you going to test that?
Equal what? Around. Oh, I don't know. There's 2 R's in there.
Is this the one where you cover it?
No.
Maybe just have her look straight forward.
I don't know.
No, you're looking for red reflex, which is fine. That's the next thing to do, right?
What's the second R?
Yeah.
Perla?
Oh.
But pupils are equal and round, so just by looking at them, you know that. Reactive to light. So you're just going to shine the light in it and notice that pupil
It's small.
gets smaller, okay? And then take it away. And then you're going to shine it again, but you're going to look at this pupil here and make sure this one constricts as well. Did it constrict? Okay, and then you do the same thing on the other side. Do the other side. You're going to practice unilaterally. You're only going to practice on one side. When you test, you need to do it bilaterally. Otherwise, I'm only going to give you 1 point. Okay? So do it on both sides initially. Okay, so you've done pearl. You need to do the ah. So what's a combination?
When we test, can we use our pen light, or do we have to use?
No, you can use a pen light. Bring a flashlight in if you want to. That's just the only light I have.
Have her look at a distant object.
And then whenever she.
And then
Right,
bring it
so look at that wonderful face right over there. Pop it up. See? It's keep staring. And then keep staring at him. Now watch your pupils. And when I tell you, look at my finger. Okay, now. That was not helpful. You closed your eyes. I couldn't even see it. Sorry. All right, one more time. Now stare and focus. Focus on that nose. All right, now look at my finger. Okay, did you see your pupil change? Okay, that's accommodation. All right. And a lot of times when you are doing a neuro test, you won't necessarily check accommodation, or you won't have a compliant patient in order to do it. Maybe they're a little out of it. Maybe it's pediatrics in there too. There's no way. So you're just going to chart PERL, P-E-R-R-L. You're not going to chart the A on the end. Okay, so PERL. And then red reflex. Did you see that when you looked through the? I remember you have to look through the ophthalmoscope. scope. And I'm telling you right now, you're going to be nervous, and somebody in this class is going to go like this. I can't see it. And you're going to shine this light in your eye. So just, take it off and just kind of just do one of these things and shine the light in your hand, just so that you make sure you've got it up. Because when you get nervous, you do weird things. Ears. Inspect and palpate the auricle, tragus, and mastoid process. This beautiful long hair. Show ears under there somewhere. There you go. And do it on both sides. Just do it at the same time. Bilaterally. Very good. Okay, so that's the pinna. Where's the tragus?
It's that little people
Yeah,
get up
and
here.
just push on it. See how it just push
That
on
really
it.
make you skinnier.
Okay. When
What?
is this painful? What's that
They
classic
say if you
for?
get this pierced, it helps you lose weight.
Yeah,
I've
external
heard that, but I don't think it
ear
works.
infection. Okay. And then, so this is the pinna, this is the tragus. What's the mastoid process?
Down here.
Right, so right back here, behind the ear on the skull itself. Okay? Okay. Palpate those things. Use the otoscope to inspect the auditory canal and the tympanic membrane. Again, I cannot see what you can see. So just, whether you see anything or not. Oh yeah. Okay, great tympanic. Great. Looks awesome. I'm evaluating you on how you're holding the otoscope, whether you are, pulling the wrong.
You're wrong.
Poor guys. We're gonna put somebody else up here, and you can complain about what they're doing.
You gotta pull their,
You gotta pull
their
their
ear.
Why don't you come around on this side, just for ease.
Don't you pull their ear down?
You pull it up, dude.
Up, down, babies.
Yeah.
Having blank
And
one.
then. Put this pinky out so you have touch your head.
Oh, yeah.
Now practice from
Just
this
take a
side.
picture of her.
You know, and be honest, if you
Oh
haven't
my
really
gosh.
practiced this or
I'd
done
go
it,
get him.
it's gonna be obvious when you test.
Are you kidding me
You're not
right
getting
now?
your points, I'm just telling you.
I
But
hate
you
you.
will.
Your video's not
It's
going on
fun.
Facebook.
We'll
It
do
is
this
going
a
on
couple more times, and then
Facebook.
it won't be a big deal. Okay, go ahead, hang it up. Make sure. Well,
Let's
at
see
least
y'all
we-
get up here and
At
do
least we
it.
practice. Hey, yeah, no kidding, doing it in front
Got
of all these
everybody in the
people.
video. Everybody hearing it. You're in it. I hate you.
Let's go. Hearing. How do you do a hearing test?
Stand about 5 feet behind them.
Okay, so come around here on this side.
Somebody other than Brittany upload a video. I'm uploading it. Everybody
Well,
has
you
a
know, we'll be that
video.
far away, actually. Come up a little bit closer because you're gonna need to
Everybody.
close the one for opposite ear.
So I'll have her.
No, you close it. Remember, she cheats. You just assume she's gonna cheat. So close it, and then you're gonna be testing this ear, and just whisper at least a 2-syllable word, nothing really hard or anything on this side. What did he say? Hello. So do this one, and whisper a different word over this ear. Purple. Very good. See, I would have said
Oh,
goodbye.
of course, my phone's gonna have low battery. I hope it dies.
Okay, nose on nose.
You're
Inspect
awful.
external nose. Okay, I looked at it. Use a light source to inspect the turbinate, septum, and mucosa. Again, just use a light source. Whether you use the otoscope or ophthalmoscope, it doesn't matter. You're not sticking anything up their nose. You're just going to kind of look. So just kind of tip your chin back and just kind of shine it and go, yep, that's a nose. Yep, looks good.
Yep. that's a
Maxillary
nose.
sinuses and frontal sinuses. What are you going to do with those?
Take out pain.
Palpate. So show me how you and where you palpate.
Right here. Right here for the front wall.
Okay, why don't you guys switch?
Did we check the patency of the air flowing through nostrils?
Oh, did I miss one? I'm
Oh, you
sorry.
got your points off.
This is a good point. Let's say you go on and do a couple more systems, and all of a sudden, you are in the back of my mind going, patency, patency. It's like, oh, I forgot something. You lose no points. If you go back and remember something later and do it later, you get the points for it. It's no big deal if you do it out of order. Okay, the only reason I want you to do it in order, it's easier
Helpful.
to learn, to memorize if you memorize it the same way every time. And it's easier for us to grade if you're not going back and forth all the time.
Like no matter where. Like,
More than twice, dude.
You are
Well,
completely
yeah, but
done.
you'll
You're like,
probably
I'm
practice
done.
on days.
Oh, wait a minute. I
I'll probably
remember
practice
something.
on
You go back,
somebody, and then we need to do it on each other without a sheet. At least 3 times. At least 3 times. Let's leave it at that.
Yeah, you're in the middle of another game. Oh, yeah. So patency, that's a good question. How do you check patency of the nose? Make sure you close one side. Breathe in,
This
don't
video
breathe
is
out.
gonna be hilarious.
No, you did that. You just didn't.
No, you get snot all over. It's gross.
You-
Breathe
you
in.
just
Have
did.
to hold their nose, or can they do
That's
that?
what you check.
So they don't cheat, you should probably hold
that
it,
what you're
but
supposed to check?
it's okay, I'm not gonna try.
that what you do?
Count
I
you
don't
off
know.
if you have them do it. If you actually do it though, you probably should have it.
You don't want to touch my nose, Angie?
Hey, you know, we're all sick. We're all sick.
Keep it.
Okay, now we're gonna see how hard it is to be the examiner. Nose, mouth, throat. Inspect lips, teeth, gums, mucosa, and tongue. Yeah, the only way you're not gonna get 2 points on this one is if you don't shine a light in his mouth. Open your mouth, nice and wide. Yep, stick out your tongue. Good. Okay.
Not say ah.
No, because number 2 you can, though. Because that's uvula and soft palate rise and phonation, so. Okay, and some of you will have partners that have great big huge mouths, and you can see everything in the back very nicely and clearly. So please, if you're a partner, open your mouth as best you can. There are some people, by no fault of your own, that have smaller mouths and or have a tongue that kind of really arches in the back and you can't see the tonsils and stuff really well. Then you got to get a tongue blade, because unfortunately, if I so choose, that's something I can see, right? I can't see inside his ears or her ears, but I can see inside their mouths. So if you can't see, get the tongue blade out and kind of push it down. Inspect the tonsils while you're in there, and then you're going to have to do the gag reflex anyway, so you might as well at least have a tongue blade in your hand, and just, you know, say ah, and then I would just go for it. Just go back and gag. If you have a really low gag reflex, like you can't gag very well, just
Fake it.
pretend. Just pretend, like, okay? If you have a very strong gag reflex, like you feel like you're gonna throw up when you gag, I would also pretend to gag at an earlier time, you know, or let your partner in and kind of practice it ahead of time. Only once, I had a student who came really close. She actually dry heaved, and I really thought she was going to throw up. And ever since that semester, and that was several semesters ago, I've told students, if you feel like this is going to happen to you, please don't. I don't want you throwing up in our health assessment lab. I will just have your partner just describe the technique exactly how it would be done to do it. Okay. Yeah, no throwing up, please. Try not to miss anything. Make sure I'm not missing something. I can move on now, right? Inspect appearance of neck for symmetry. So just, you know, sit up straight. My wife says sit up straight. Look at his neck, have him look straight on, and that, you know, you should at least be able to see the trachea and that everything should be symmetrical. Range of motion of neck. Yeah, and then don't forget the rotation. Be very careful about doing the whole neck roll like this, because some people who do have neck problems, you can pinch some nerves doing that. So it's better just to do the front and back, you know, ear to the side, and then to rotate. Okay, that should be sufficient for range of motion. Okay, here's the first part of it that you have to talk other than the introduction. All right, so I won't ask you if you've not memorized yet, but let's see if you know where they're at. Pre-auricular, right in front of the ears, right in front of the tragus, kind of. Post-auricular, and remember all of these nodes are in chains, so it's okay to kind of move around in a certain area and use two fingers. I think Mrs. Daly tells you about kind of doing in a kind of a rotating motion a little bit. Okay, pre-auricular, post-auricular, occipital. Yeah, right back here. This part of your skull is your occipital bun, so it's the back and base of your skull back here. Tonsillar. And there's another name for tonsillar in your book, of the J.
Justice something.
Yeah, that's kind of a weird, and some students, they will use that term instead of the tonsillar when you're saying it. That's fine, you don't lose points for doing that. That one's just harder to say. I think tonsillar is easier. And everybody kind of knows, everybody's had sore tonsils at one point in time or another. You kind of know where your tonsils are right here. Okay, so tonsillar, submandibular. Where's your mandible? Yeah, it's your lower jaw, so it's along your jawline, right here. Okay, submandibular. Submental, right at the end of your jaw, right down there. Superficial cervical. Yeah, right on top. If you kind of move your neck off to the side, you'll have this big muscle right here along your neck. Superficial cervical is going to be right kind of on top of that muscle. Started up here, right at your jawline, coming down. Okay. That's superficial. Deep cervical is going to be kind of in front of and underneath that muscle coming down. Okay, that's deep. Posterior makes sense, as would be where? Behind the muscle. Posterior cervical, so kind of in the back of your neck. Those three, I think, students get confused. So superficial on top, deep more in front, posterior and back. Supraclavicular. Right, everybody knows, you remember your clavicles right here, so it's just on top of those. And if you kind of shrug your shoulders, it'll a lot of times stick them out a little bit more, so it makes it easier to see them, find them.
So we would say their names
as you're doing them. Yep.
Shit.
Yep.
We need to hurry.
Okay, palpate and auscultate your carotid arteries. Or no, do you have a bell on yours? Okay. Gotta use a bell. Please, please, please check your stethoscope. Some of you have a pediatric diaphragm on the other side. If you do, it just should unscrew. You should have another piece, probably in your box somewhere, that has a bell on it that you can put a bell on. Some of you have just the one piece that is just a diaphragm, but you have a special eye stethoscope that instructions should tell you that if you push firmly, you get a diaphragm sound. If you hold it lightly, you get a bell sound. Those are kind of specialty stethoscopes, but there's usually one or two in every class that has a stethoscope that's like that. If you don't have either of those, if you only have a diaphragm, you do not have a bell, or you forget to change it when you come in and you only have a diaphragm, just use the one that's in here for that so you can have a bell. All right? Don't want you to leave here not understanding what the difference between a bell and a diaphragm. All right, so got it on, make sure your bell is turned on. 3 different spots. So the first one, you're going to start up here where you're not supposed to palpate, right? That's our carotid sinuses, and you have an elderly female patient next semester that's like 90 years old, and you start palpating up here, and she's going to faint on you. She'll hit the floor. So you don't, but that's where you're going to listen. It's okay, you know, the bell, you listen lightly with the bell. You don't have to be pushing on it or anything. And then you come down to where you normally would palpate the carotid pulse, and then you're going to come down low. Okay, and you will hear referred heart sounds up in the neck. You have a normal, strong, healthy heart. You can hear that heartbeat, right? But it should be just kind of a normal, quiet heartbeat. It shouldn't be turbulent, rough, you know, loud, anything like that. And if you listen to lots of normals, then when you do hear a bruit, you'll be able to identify it. And don't forget to do it on the other side. Okay, bilaterally.
10% is going to knock out any second.
Okay, heart. Inspect and palpate for an apical impulse of PMI. All right, sit down, or lay down, please. No, yeah. No. That's right. Okay, so where is the PMI, the point of maximal impulse? It's a little low. All right, so you've got your. Nope. You stay fully clothed. We're videotaping.
I mean, I haven't.
You don't know, you're fine. This is about your 4th or 5th intercostal space. Now, you will practice this with your partner from now until the time you're supposed to perform it. And I tell you, you're going to come for your exam, and all of a sudden you're going to be able to feel it. Oh, I've never been able to feel it before. That's because your partner is freaked out because they know they have to go next, right? Yeah, if I were to get him to get up and run around the trailer like 3 times and come back in, I'd probably be able to feel it too. I can't feel anything right now. It's totally normal not to feel it. I am grading you on whether or not you remember to do it, check it, and then you're checking in the correct spot.
What does it mean if you feel it all the time?
Just they have a normal, or they have a strong PMI, strong heart rate. There's nothing wrong with it
So
necessarily.
since you're inspecting for it, like you're looking for it.
Yes,
do
you
it
will
with
be
the
looking
clothes
for
on?
it. So for that patient, yes, you're going to probably want to, you know, if it's a guy, just take their shirt off. If it's a woman, you're going to be wearing, like she told you, like a sports bra or a tank top that you can kind of pull up, or if they're wearing a bra, kind of pull the bra up just a little bit so that you can kind of look right there where that PMI spot is to see if you can see a pulsation or not. And then if you can see it, then you'll know just where to feel. If you can't see it, go ahead and palpate it and see if you can palpate it, because it'll kind of be underneath where the bra strap is. It's about where most people's 4th or 5th intercostal space is going to be. Okay. And it's not abnormal not to feel it. It's perfectly okay. All right, so PMI, and you're going to auscultate. This is the second place that you have to talk, or the only other place that you have to talk. You don't have to put them in your ears, but show me with your stethoscope with the diaphragm where the locations are. Apple, pecan pie, taste, aortic, pulmonic, second pulmonic, or Erb's point, tricuspid, mitral. That's what you have to memorize and tell me. Okay, aortic, where's the aortic site? You're going to start where?
At the top.
It's hard to get
Right side, isn't it?
Okay, where is it?
So right.
Right
Yeah.
intercostal, so second intercostal space, right sternal border. Don't listen over the sternum, okay? You want to listen to the side of the sternum, in between the ribs. You want to get as, you know, as little bone between you and the sound as possible. Okay, so right intercostal, second intercostal space, right sternal border. Okay, that's the aortic site. Pulmonic site.
Straight over.
Straight across.
Yeah.
Okay, it's going to be the second intercostal space, left sternal border. Second pulmonic site, just down one. Third intercostal space. Okay, tricuspid. 4th. Okay, these are all along the left sternal border. The only one on the right is the aortic. Okay, mitral.
Below.
PMI. Same place you were just feeling, looking for the PMI is the same place you want to be for your mitral site to listen. Okay, fourth, fifth intercostal space, mid-clavicular line. Okay, clavicle straight down. Okay. Use the diaphragm, and when you're going through with the diaphragm, just tell me the 5 locations, and then turn it over, so you're on the bell, and then listen to the 5 locations again. You don't have to say them again, unless I say, why don't you say them again? It's probably because maybe you said them wrong the first time, or I was writing something else and I didn't quite hear it, and I just want to make sure you got it right, because I wasn't sure if I heard it right or not. Okay? But otherwise, you don't have to say them again. And then, third one, also the apex of the heart. Apex is just another name for PMI or microsite, right? As the client lays on their left side, so roll over on your left side. There you go. One more. There you go. There you go. And then you can come over to this side, or you can, you know, if you've got nice long arms, you can reach around, but I think it's probably easier if you just come around to this side. But this one, come over here. Walking. Walking. All right, so where do you think it would be? Yeah, right there. And this one, what do you think? Do I want you to listen with your bell or your diaphragm?
Diaphragm.
Bell.
Bell.
Okay, you can lay normally. To put them on their left side, you're listening for S3, S4 murmurs. And all of those you're more likely to hear because they're lower tones, but kind of quiet with your bell. Okay. Abdomen, inspect the abdomen. Good. Auscultate the abdomen times 4 quadrants. What is your point of reference for your 4 quadrants? Yes, your umbilicus. So you're going to do your right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Doesn't have to be in that order, but kind of go in a circle. And you want to be there just long enough to make sure you hear some vowel sounds in each side. Good question. Bell or diaphragm? Diaphragm. Okay, so now you're going to palpate light and deep. What did Mrs. Bailey tell you? Did she give you any recommendations for this?
Start light and deep.
Okay, you're doing light and deep at the same time, or you do all light first and then deep?
You do light,
All
medium,
light
deep.
She did it all at the same time.
Okay. She teaches that I don't care, whichever way you want to do it. Just to get all the points, you got to do
When
both.
did we get
CBA
into
tenderness
that?
and rebound tenderness. Which do you want to do first? Rebound tenderness first. So let's do rebound tenderness. Where and how are you going to do it? What's it testing?
Oh, for
No, not gallbladder.
appendix.
Appendix. Appendicitis.
Yeah.
If you have a patient that is coming in with acute abdominal pain, you do not want to do rebound tenderness, particularly over the site, which would be where? Where is the appendix located?
Right in your
right lower quadrant.
Yeah.
Because you risk rupturing that appendix. If it's large enough and close to rupturing, you go ahead and push on it and, oh, that feels better. Yeah, it feels better because you just ruptured it. And now this person's going to have extensive surgery and they're going to be in the hospital for a long time because of you. Probably would have ruptured anyway, but don't risk it. If you really feel like you have to do it for whatever reason, do it on the opposite side. Do it away from where the acute pain is. None of you, hopefully, will be in an appendicitis attack when you come in for your checkups. So we are not going to be having abdominal pain. So go ahead and do your rebound tenderness over the right lower quadrant. Okay, because that's where the appendix is. They're not having any acute pain. It's okay to do it right at the site. All right, so what are your instructions for rebound tenderness? Just do it. How would you do it?
Push you and let out.
Rebound tenderness. Push it down and then lift up quickly because it's rebound. Is there any pain when you let go? That's what you push down. So I'm just going to push slow and steady and let me know if it hurts when I let go. No. That's the answer for everybody. If it's a yes, I'm like, I did catch kidney inflammation one year. Okay, so CBA tenderness. What does CBA stand for? It's all right, help her out. What's CBA stand for? Costovertebral angle. Okay? Sit 'em up. Yeah, it's on the back. Only once did I ever have somebody try and percuss customer angle on the front. I was like, no! That was probably the only time I've ever jumped out of my desk to like stop somebody from an assessment. Because I thought they were going to hurt, because, you know, check that, you know, it's a, you're pounding on it. I don't want to pound them on the front. That hurts. You got to turn around so the video cameras can see it. There you go. So how would you check it, you think? Right. Okay, on the other side? Okay. Maybe just a little bit lower. You're checking the kidneys is what you're checking. And don't be afraid to thump. Good.
At what time or what point do you listen to their back? Because I remember her saying something about listening on their
lungs.
Just during the lungs. Okay, I wasn't sure when.
Which we are at.
Okay.
Observe
Can't remember.
APT and skin turgor. Okay, what's APT? Okay, so you're looking for a ratio of what? 2, 1, or 1, 2, however you want to do your ratio. And how do you check your skin turgor, or where are you going to check it?
I thought you do the class.
She asked you to do it up here, didn't she?
Yeah.
Like over the clavicles. Just because it's more central location, all right, as opposed to your periphery, which is more, I don't know. If you get an older patient and the skin, especially out here, it tends to be a little, loses elasticity, shall we say, a little bit more. Okay,
6% and my video just shut off.
where am I? Note quality, rate, symmetry of respirations, no accessory muscle use. You're just watching those breathe for a couple times, I don't know. Do you need to check a respiratory rate? Technically you do. I would probably you'd probably just say I would count the respirations for how long? 30 seconds multiplied by 2. Is that what they teach you in skills for normal, how to do it? Okay. If it were a child, how long would you count? 1 minute. 1 minute. Very good. I won't ask you that. Auscultate anterior, posterior, and lateral chest. Okay, so again, don't put it in your ears, but just show me where you put your stethoscope. Okay. Okay. I had a student in level 2 I had to correct on listening to the lungs. Don't forget to go side to side, so you're comparing one side or one lobe of a lung to the next, and then move down and then come back over. How many times on the front does Miss Staley say you need to listen? Not quite 12. 6, 9, or 8, or something like that. It's a weird number. And then you do anterior, and then what do?
Posterior.
Posterior and lateral. So come around on the back. Or if you have a real agile patient, they can swing their legs over. And you're going to. Yeah, and just keep going. Yeah, you know, take your time. And when you're coming down, as soon as you start hearing, you know, quieter sounds, you can try coming down one more and see if you can still hear anything. Just kind of get an idea of where the bottom of the bases of the lungs are. And then don't forget to come over on both sides to get your lateral. All right. Upper extremities. Check for color, temperature, texture, moisture, lesions. So what are you going to do to make sure you get 2 points on that one? You're going to look, but you're also going to feel. And I would do them at the same time. You're kind of looking at them, come over, and then kind of start up here, and you're kind of just going to feel and see if the musculature is the same, if the temperature is the same. You can go like this, or the back of your hands, and then for temperature and moisture.
Oh, what time is it? Okay. What time is
Palpate brachial and radial pulses. Okay, and other side. Okay. Can you do one or the other? That's fine. If you're having a hard time, you know, well, I have a lot of patients students, they're going to check them at the same time so that you can feel, you know, make sure that they feel the same.
Can you do
So,
that?
a lot of students have trouble with this brachial pulse, so if you want to do it one at a time, that's perfectly fine. I'd rather you get a good feel for the pulse than having to do it at the same time. Okay. Capillary refill, contour of color fingernails. Bilaterally. Okay. Biceps, triceps, or brachioradialis. You only have to pick one. So which deep tendon reflex would you like to try?
Oh yeah, I was about to say knee.
You can do lower extremity. How about that? We'll switch after this. Okay, so we've got 3. Just think of this one, you're going to hold it up like this. You're going to tap the tendon back here. Make sure if you're going to do, what is this one? Which one is this?
That's probably the one I'll
Triceps,
do.
okay? If you're going to do the triceps, make sure you have them move their arm back and forth so you can feel that tendon, so you know where that tendon is. Be very careful not to get over to the side and hit that ulnar nerve. Remember, make sure you're right up here on the top.
That's gonna be me.
And you want to have nice, heavy arm, like you're going to like fall, all right? Kind of bring it in just a little bit. This side. Really hard, and you want to get more on this side, okay? So that's the triceps. Okay, biceps would be right here, and you can feel it right now, because he's holding his arm, you can feel that tendon, right? And this is the only one that is indirect, because you're going to hit your own thumb. And that's going to be really hard to do if you're not holding his arm, because if you've got tension in that arm, it's going to be hard to get a good response. So yeah, I kind of hold it. And look over there. Have them kind of look away. Sometimes that'll... It does. Yeah. Okay. Brachioradialis. Where's that one? This one's the hardest, and you get the smallest response from it, but where is it? It's right here. It's in your forearm. It's a tendon. If you kind of wave your hand up and down like this, oh, the parade wave, you know, you go like this. It's a parade wave. I don't know. It's never in between. So that's that tendon right there. You kind of feel it slide back and forth, and that's what you're going to hit right there. And you'll get a little bit of contraction in your forearm. Pick one. I don't care. Bilaterally, please. Do it on both sides. If he does not respond, does she lose any of her points? No. I am grading her, not his response. So she is hitting it in the right place, doing everything right, telling him to, look away, be distracted, relax his arm. She's doing everything right. She gets the 2 points, whether he reacts or not. Doesn't matter. If you want to pretend and give a reaction, you can, but you don't have to. Okay. Range of motion and strength.
40 at 37 minutes. How your phone
Okay.
hasn't died yet.
Range of motion of upper extremities. You don't have to do all of the joints in your upper extremity. Just pick one. You can do shoulder. You can do elbow. You can do wrist. And the strength. So if you're going to do shoulder, make sure you come all the way up, back, forward, back, and because it's a rotary motion, they have to do the whole thing coming all the way around.
So you did wrist, what would you do?
Hmm?
You did wrist, what would you do? Just flex your little.
I don't know. I guess you can go like this too, right?
You got side to side.
You got side to side on the wrist. You got a little sliding motion. I would suggest the elbow because there really isn't much you can do with the elbow. I guess even that. Well,
Radius is rotating.
that's the radius is rotating, I guess. That's kind of I don't know where that's at. I don't teach musculoskeletal. I don't have to know that.
You do that bilaterally.
Supination and pronation.
Yeah, bring it up. So, but just not range of motion, strength. Yeah, don't forget the strength, the push and the pull. All right, switch. One more, we're done.
Do you do grip strength too? Do you do grip strength as well?
Yeah, you can do grip strength. That's fine. The problem is, if you're evaluating the elbows, the strength for the elbows is pushing and pulling here. I think Mrs. Daly does make a big deal about it. She wants to about All right, if you have Mrs. Daly, go ahead and push and pull with the elbows, but don't forget to do the grip strength too.
Do the grip strength,
Lower
what do you
extremity.
mean?
She didn't have it.
She didn't? Okay. If you do something that's not on this form that's extra, you don't lose any points if you're ever in doubt. Okay. Lower extremity.
Uh-oh.
Skin, color, temperature, moisture, lesions, hair distribution, edema. Okay, so all that, just like with this, make sure you're wearing shorts or something that day so we can get at your legs. Don't wear jeans that are tight and you can't roll them up. It's just not nice to your partner. We're gonna
Why
pretend
is somebody
like
looking
you're-
at us?
And so you're just gonna kind of look, and you may have to have them stand up so you can kind of see the back of their legs too.
Make sure I shave my legs that day.
Edema. The only thing that's different with lower extremities from the upper extremities is edema. So how do you check that?
You would need to check for.
If you're gonna check pitting edema, yeah. And generally you wanna do it at the feet or the ankle level. You wanna do it as low as possible for dependent edema. And just kind of push, hold it for a few seconds and let go to see if it stays, you know, the fingerprint stays in there and how long it resolves. Remember she talked about pitting edema in class? Palpate the dorsalis pedis and the posterior tibialis pulses.
Feet.
So where's the dorsalis pedis? Right on top. And then the posterior tibialis.
In the back. Yep.
You're gonna get it right though, the checkoff, aren't you?
Yeah.
I will come up and I will hit your hand. Well, it's on the inside of the ankle. Okay, cap refill, contour of nails just like you did on your fingernails. Just remember bilaterally, do it on both sides.
If you have
Yes, you have to squeeze or toe. Squeeze and let go. How fast should the cap refill be? Yes, should be fast, like 1 to 2 seconds. Well, somebody had a question about toenail polish. If you just had a pedicure,
Her
and
phone's
you don't
on.
wanna take
My
the
phone
toenail
died,
polish
or
off, it's all
was
right.
done for.
You can get a good cap refill just by pushing on the end of the toe and letting go and looking at the blood return there as well. Okay, patellar and Achilles tendons, again, or deep tendon reflex. Again, you only have to do one, you don't have to do both. But patella is probably the easiest. There you go. And how would you do the Achilles?
When you have.
Yep,
Put up.
put the foot up and then hit the Achilles tendon. Perfect. Don't forget to do it bilaterally. Where am I? Range of motion and strength. All right, again, I probably would stand up for this one and just have them stand on the side and kind of hang on to it. And you want to do the knee or whatever, just bring them up and straight out. Good up and straight out. If you want to do the hip, you got to go up, back, out, in. I mean, it's that ball and joint. There's all kinds of motions for the hip. Don't do the hip.
You don't provide resistance?
And then, because you range of motion, and then you need to do strength. So when you're doing strength, then you would get the resistance. So I would probably have her sit back down, probably the easiest way to do it, and then just kind of push against it and have her push against, and then have her pull right. And you can do them both at the same time. Test sensations, light touch to feet, top and bottom. And you have your cotton ball. You're not going to do this, I'm not going to take your shoes off, but bare feet, right? Close your eyes and tell me when you feel me touch, all right? You're just going to do it on the top of the toes, like this, and then the bottom. And maybe a couple places on the bottom. Because if you have a patient with peripheral neuropathy, generally your advanced diabetic patient, something like that, that's where they're going to lose sensation first. Also, just normally,